What's up guys, and welcome back to my channel. As promised in my last video, this video is going to be about the glorious aid bag. Now when you ship off to AIT to become a 68 whiskey, they're going to teach you in the classroom a certain way on how you should set up your aid bag once you get to your unit. Now honestly, in my opinion, I honestly think you should set up your aid bag based on how you are going to be able to find things quick and easy. That way you could treat the soldier right away. Now I'm going to show you some of my personal tips and tricks that I do so that anytime I have to access my aid bag, I know where everything is right away. Now let's get on with the video. Okay, so this is more or less going to be the aid bag that you're going to get once you get to AIT. You might get this one or you might get the cool Hua OCP one. Now, as I was saying earlier, there are tricks that you could do. That way you could have your aid bag organized. In AIT, they taught us to use medical tape so we could label each of the compartments, and that way we know where everything is as soon as we open our bag. The basic stuff that you are going to use are needles, IV kits, lines, fluids, tourniquets, and some other things that I will be showing you. Okay, so here I'm going to be talking about the basic essentials that you are most likely going to see once you get to AIT. Now, before we get into any of this, very important, EMT phase and whiskey phase. First thing you're going to do is don your BSI. BSI for my battle buddy and I. You're going to learn to preach that, and it's going to be so annoying. BSI for my battle buddy and I. I'm not kidding. So if you watched my last video, you remember that I stated that in whiskey phase, you are going to learn HABC, hemorrhage, airway, breathing, and circulation. So I'm going to start explaining off everything that I have here by those sections. So first, we're going to start off with H, which stands for hemorrhage. So like I said in my last video, when you're in the battlefield, you want to control that bleeding, right? So in that situation, you would use the tourniquets. So here I have one wrapped. You can see how it comes out in the package. And I have one unwrapped. So basically the tourniquet, you just open it like this, right? And you take it out. And here is basically where you would crank it up, right? So you loop it through, right? You pull it. Let's pretend this is like on a leg. Then you would take this and you were going to rotate it and then place it in here. Now, once you start rotating this, it's going to tighten. Then you're going to take this, put it here, and then see it says time here. So normally you could write it here. They taught us to take the 3-inch tape, write the letter T in capital for time, and then put the time, rip it, and then tape it on the soldier. The next step to control any bleeding is packing the wound, right? So for that, we would use a combat gauze. Now, the combat gauze, basically, you would take out and you would just keep packing it up until you're done. Once you used all the combat gauze, then you're going to hold pressure for 3 minutes. And then at that time, the sergeant or the instructor is going to say 3 minutes time has elapsed, right? So that means that the bleeding has been controlled. So that's hemorrhage. Now let's go on to airway. So for airway, I have 2 of the things from many that you're going to use at AIT. The first one is the MPA. Now, this is going to be your worst enemy at AIT. You're going to get so many of these that your nose is just going to be over it. So basically, the MPA, like I said in my previous video, is used to open up the airway if it's not. But you do not, I repeat, you do not insert an MPA if your patient has any facial traumas, broken face, broken nose, any burns, anything to the face. I don't care if the bone structure looks perfect. You see any burns, just don't shove it in. You do not put this in. The next thing that we have is the crike kit. That means that you are going to perform a crike. So basically, the crike kit comes in this nice little case, which I think is pretty handy. So in your crike kit, you have your scalpel, you have your hook, your pump, your syringe, your strap to hold it in place, and it comes with 2 alcohol pads. Now the procedure for this basically is you would take your scalp to make the incision. Once you have the incision, you will use your hook, which you are going to fight with this thing in AIT, because this one comes with a nice little plastic cap, but the one at AITs don't, and the hook constantly gets caught. You're going to be like freaking trying to pull it out. So then you use your hook, you insert the hook, and you pull towards you, right? And that's gonna help you see inside the soldier's trachea. Once you made the incision, you inserted your hook, and you have a good view of the trachea, you're going to insert the tube. As you can see, it has this little rubber part right here. That's a balloon, right? So once you insert that in, you are going to use your syringe, and you're going to connect it to this blue little hose. with the syringe, you are going to pump up the air, and that's going to expand the balloon. And that's basically going to make sure that this holds in place and it does not move. But just because that's in doesn't mean there's like no chance of it moving. That's what the strap is for, right? This strap basically hooks onto both of these strings right here, and you hold it in place. Now, at AIT, they taught us that yes, you use this for your testing with the dummies, but in real life, it's good to use this, and just to be safe, use some tape. If you don't have some 3-inch tape, you can use the 1-inch tape and just tape this bad boy on and make sure that it is not moving. That crike is secure and in place. Because sometimes your soldier is in so much pain, or maybe their position of comfort is like to the side, and you have to place them to the side. You don't want this crike slipping out. That is a big no-no. Your soldier's gonna hate you. So that's airway. Now let's go on to breathing. Now, in breathing, you're not just making sure that their breathing is okay, right? You are looking for wounds. So when you open up your patient's chest, you're checking the chest to make sure if they have any gunshot wounds. If they do, then you're going to apply a chest seal. A chest seal basically is preventing any air going in and out from that wound. Right? You only want air going in when the patient is breathing. So this is going to prevent any air going in and out from that hole. Now, it's really simple to apply, but if you forget, in the back, they have 4 steps on how you apply it. Basically, the chest seal is this little square that is extremely, extremely sticky, right? So you take that out, and it has a little peel. So you peel that off, and you apply it to the chest wound. Now, before you actually apply it to the wound, right? Let's pretend that this is my wound, right? If I'm going to apply the chest seal, right? I'm taping it here. As I'm sticking it, I'm going to ask the patient to exhale. I'm going to scream, exhale, 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 as I'm squeezing it down, right? Why? Because after you exhale, the next thing you want to do is inhale, right? Because you want to breathe. So why? When that patient breathes in and inhales, basically it's going to suck in that chest wound. So additionally to that adhesive that it had, that patient inhales and it's going to suck it into that hole. And that just adds an extra seal to the chest seal. You want to make sure this bad boy is nice and tight on that wound. There's no possibility of any air going in and out. Right? Now, once you apply the chest seal to the chest, like I said in my previous video, you want to check the back for exit wounds because we're human, right? So we have an entrance wound, and on your back, you have an exit wound. So you want to make sure you seal that wound on their back. Now, let's say, like in this case, I only have one. Now, you're thinking, what can I do? Now, in AIT, which I thought was really handy, they taught us that this little packaging can be used as a chest seal, right? So once you peeled it open, this could be pulled, and it expands about like this big. Right? So you could use the inside of this as a chest seal, right? So you would have it and you would do the same steps. Now, what I did was I took a piece of 3-inch tape and I taped it to the top and I put it on the patient, on the dummy's back. That way it's centered on the wound and you don't have to be worried about trying to hold it and taping it, right? So you tape the top part of it, right? And just like we did with the front part, you're going to start smoothing it out and you're going to say exhale, exhale, exhale. And you're going to make sure you tape all 4 sides. Now, I like to use 3-inch tape for this. Why? Because it's pretty wide, right? So you have your margin of error for leaving space between skin and the chest and the improvised chest seal is very slim, right? If I use the 1-inch tape, I mean, look at that, right? So we're freaking out. So you're taping all crazy, right? So you don't want that. So with this, if you're nervous and your margin of error is still going to be pretty slim. Right? Once you applied your chest seal, obviously now you want to check the breathing of the chest. You want to make sure it's rising equally up and down. If we're doing the seesaw, that means that the soldier probably suffered some blunt force trauma or from an injury, shrapnel, anything, and they have a collapsed lung. That means there might be any fluid, any air, extra air. Something happened to that lung where it collapsed, right? So in that case, we're going to insert an NCD needle. This is a decompression needle. You just twist the cap, right? And here is your needle. Be very careful, right? So here we have the needle. So at AIT, they're going to teach you how to properly insert this. Now, you have to be very careful. I cannot tell you how many battles of mine stuck themselves with this at AIT. Like, no, right? So once you find the location where you want to put it, right, you take it and you insert. Once you insert, you're going to count for 10 seconds. Now, this one, I don't know why, it didn't have a little cap right here. The one at AIT is going to have a cap here. Now, why I say count for 10 seconds? Because you're going to insert it, and basically you're going to wait for 10 seconds because once you did, there's a built-up of pressure. And if you just pull it out right away, you could break this little, it's like a straw material. So that's at least what they told us at AIT, right? The pressure could cause the straw to bend. Well, I call it a straw, but it's not. So you're going to count for 10 seconds. Once that's in, once you count it for 10 seconds, your instructor is going to say 10 seconds has elapsed, whatever, and then you are going to, be careful, remove the needle. And this is going to stay inside of your patient. Once you have that in, right, you have your NCD in, you can't just leave it there, right? You can't just walk away. You're going to secure it. Now, something that they taught us at AIT, which honestly saved my life, how to secure it so you're not making it look like a hot mess. You're going to take your 3-inch tape, right? Well, that was ugly. You're going to take your 3-inch tape, right? Let's say this is a good amount, right? So that's what I want. Now, I'm going to take this ugly piece out. I'm going to make what our sergeants like to call MC hammer fans, right? So you're going to take it, try to get it as close to the middle as you can. Obviously, it doesn't have to be perfect. And you're just going to rip like so, right? MC hammer pants. Looks like little pants. Woo. Cool. So then you're going to take your NCD. Let's imagine this is the NCD inside of my patient, right? It's in there. Now I'm going to take the tape, put it like so, and I'm going to wrap one side and then wrap the other. Doesn't look pretty there, but I'm telling you, it works. It works, it works, it works. And it saves you a lot of time during your CCAs, and you don't have to worry about wasting time on that. Okay, now that I explained breathing, next up is circulation. Okay, so in circulation, you're gonna have a few things to deal with, right? The first thing you're gonna do in circulation, right? You're making sure first that any tourniquet or hasty tourniquet that you applied is still in place. Hasty tourniquet means I didn't have an actual tourniquet, so I improvised. I took a shirt, ripped it up, found some sticks, made it together and tied it up. If I took a belt, right, and I substituted for a permanent tourniquet for the patient to be transported, right? So once you check all that stuff, you checked all your packed wounds, everything is packed, right? So everything is good. So now you're gonna move on to checking pulses. Like I said in my previous video, you're gonna check bilateral radial pulses. That means both of your pulses. Remember, no thumb. Check that pulse, pulses are present. Okay, cool. So you insert that saline lock, we're good to go. But what happens? Your patient all of a sudden is going downhill. First thing you're gonna do is gonna insert a line. So for circulation, for sticking, I have various needles here. In AIT, you're most likely going to use this 18 gauge needle. Right now, this one is super simple. All you got to do is twist it, pull the cap, and you're ready to stick, right? In my unit, I got this version of the 18 gauge needle. Now, when I saw this one, I was like, what? Because hello. Big difference, right? Now, this one is pretty cool because once you have your vein and you're good to go, and you got the catheter almost in, it has a push button that once you press, it ejects the needle into that tube, right? So it's not like this one where you stick, right? I had it backwards. It's not like this one where you stick and then you push the catheter in and then you pull the needle out. This one does it for you. So you would just insert, push the catheter in a little bit, and then you would press on this little white button. I'm not sure if you guys can really see it. And boom, just puts your needle in there and you're good to go straight into the sharp container. You don't got to worry about accidentally sticking something else. Now, the smallest one that I personally have is the 20 gauge. I did have some 22s that I used for last year's annual training, but I ran out. So this is the 20 gauge and it's pink. Also, just like the new one, now this one is just like this one, but obviously it's pink. Now, back to color. That is actually a really good way for you to know what needle you're picking up when you're in EIT, right? Because when you get tested, they're gonna lay out a bunch of needles in front of you. And if you pick the wrong needle for a certain skill, that's a fail, right? A lot of my battles confused certain needles for other needles, and it sucked, right? It sucked. So colors are a good way to remember, right? Green is always 18, pink is 20. But like I said, you're not going to use this at AIT. You're always going to have this one. So the one you're going to have to know the difference between is this one and the NCD. I cannot tell you how many people messed up their decompression needle skill because they confused this for this. I don't know how, but they do. Now, once you have your needle picked out, the first thing to do is to set up your area, right? This is a sterile field sheet. So it's a blue sheet, probably about like yay big. And basically this you use so your area is clean to stick your patient. Now, obviously, hello, if you're in battle, this is the last thing you're thinking about, right? But let's say you're in the clinic, it comes in handy. So you spread it out and then you take out your IV kit. So basically your IV kit has your compression band, has a little bit of 1-inch tape, so don't go crazy with it. Always have extra. It has your Tegaderm, which is basically like clear. If you've ever been to the hospital, it's like a little clear adhesive that they put over your saline lock so it stays in place, right? And then it has a little bit of gauze and 2 alcohol wipes. So it's pretty cool, pretty compact, nice to have. Now, obviously, you can never have enough alcohol pads. I mean, you need them for everything. Cleaning the wound, cleaning before you stick, very important to have. Now, me personally, and at AIT, they taught us a few skills to use with gauze, right? Now, gauze is good, obviously, if you're going to take out the needle, you give them a little bit of gauze, hold it in place, put a Band-Aid, put some tape, good to go, right? But at AIT, they taught us if you take one of the things of gauze, now you could split it in half, and when you put your saline lock, you could take a little piece, fold it, and then just put it under, and that way your saline lock is easier to access. Again, it also honestly depends on your liking. Now, once you have all that done, then you could proceed if you have to put on a line to get your line ready. Now, this is a line, pretty standard. You're going to see different versions at AIT, but this is one I pretty much worked with throughout all of AIT, right? This is your line. Now, very important, you want to take this out, and you want to take this out, clean everything, and make sure when you connect this to your line, you want to drain all bubbles, any air that you have in here. Because even if you got your vein, you didn't miss, and then you just straight up open this line with air, you're going to infiltrate your patient. It's not going to be good for them. It's going to be a very, very bad day. So always watch for air. Now, depending on your patients, you're going to have 2 different types of fluids. We have our normal saline. Here we have 1,000 milliliters, a huge bag. At AIT, you're either going to work with 100, 200, so don't worry about that. Or you have your lactated ringer. Now, very, very, very important. You have to know what are your patient's injuries and what is their situation, right? Because for certain patients, you don't want to insert normal saline or lactated ringer. Example, burns, high blood pressure. Certain injuries, you want to make sure you know what's the status of the patient before you give them the right fluids, right? In other cases, hey, you just may have lactated ringer, or maybe you just have normal saline. You deal with what you have. But if you have the option, be diligent. Make sure you know what you're doing. You set up your line. You got your fluids running. You secured that line. Now, what do you do with the needle? I'm going to just throw it away in a dumpster. Wrong. No. You're going to put it in a nice, sharp container. Now, this is a tiny, compact, sharp container compared to the one at AIT. At AIT, you're not going to have one for yourself. Your sergeants are going to be walking around back and forth as they're grading everyone, and they're going to have the big red ones that you see normally in hospitals. And when you say ready to stick, your sergeant's going to come kneel next to you and watch you like a hawk. You're going to stick. Once you stick, you're going to say, once you stick, you're going to scream sharp, and your sergeant's going to hand you the container. Boom. Ready to go, move on to the next one. Now, over here, I have some extra essentials that I personally like to have when I have annual training or any kind of training in general, right? So this right here is like what I like to call my little kit. This is your medicine box. Now, I got this when I went to my unit. I didn't have this at AIT. I think it's really cool, right? Because you could just put like the medical essentials for any like small care. So I just have different kind of meds here for headaches, any body pains, allergies. Now, very important, I like to put the name, the dosage, and the expiration date, because obviously you want to know what you're giving, how much you want to give, how much you're giving, and especially because you are going to document this on your 600 forms, which you're going to learn on your SOAP notes, which is basically a document that states the soldier that you're dealing with, what's wrong with them, what's their main complaint, where the pain is, and what you see, right? But this is going to be more for sick call, not in the field, right? So you could document everything, and that way you have proof of what you gave them. Here I have some eye drops, have some antifungal cream, which in the field, oh my God. They don't change their socks for like 5 days, and then their feet are on fire. And then you give them this, and they're ready to just go for like a month again. I swear, they just have the resilience of a bear, I swear. And then we have anti-itch cream, really good, poison ivy. And of course, I have bandages. I mean, hello, they come in handy for everything. Now, this thermometer I got at Walgreens for $7.99. Super great. What I love about it is that it comes with the little sleeves. So that way, you know, you keeping the hygiene good, you keeping the germs, everything is, you know, can't be too careful nowadays. So the next item on that, I have some calamine cream that I got at Walgreens. Now the calamine bottle was like huge, right? And I was not about to carry that. So I just got a little bottle from Walmart. I think it was like 89 cents or so. And I just filled it up, labeled it, and we're good to go. Expiration date, very important. Next up, I have some nasal spray, Field, very good. We have some Aquapic tape. This is really good. I hope I pronounced that right. Weird name, but oh my God, my battles in my unit, they love this. Like, I cannot tell you. Usually, I'm not too fond of like stomach medicine because it tastes, you know, horrible. But I did find this vanilla one, and a lot of them told me that it tastes like Ensure. And believe me, when those MREs started, you know, hitting the wrong way, this was their best friend. I have some Peptol, you know, pretty basic. Now, something that I personally invested in was this blood pressure cuff. At AIT and in your unit, they're going to give you the, you know, the regular pumping one, but I personally love this one. I also carry the non-battery one because, hey, you never know when batteries are just going to die on you. But I love this one because I could just place it, and as it's reading, I'm moving on with my assessment. I'm not, you know, trying to listen to, you know, the tick of the blood pressure cuff, or trying to look at the blood pressure cuff tick to see, because it's too loud, right? So I have it pumping, it's reading. As it's reading, I'm still doing what I need to do, and I get my evaluation done. Next to that, you're going to get an SpO2 machine. Now, please guard this with your life, because I've looked up on Amazon, and it's true. These things are expensive, right? These AAA batteries. Now, it's really easy. You just take off the back, and right here, it tells you, you know, plus, minus. So we're going to put plus over here. We're going to put minus over here. And then you just insert it. Make sure you push, right? Hold it. And there it's on. It's on, green light. Now you just want to put it on your patient's finger. Give it a few seconds. It's reading. And there we go. Wow, I have really, really good oxygen. It's really good. And it's showing my pulse. So that's what I really like about it. It gives you your blood oxygen level and your pulse. Really cool. So always want to watch that number. Anything lower than 94, 91, oxygen is really bad. You might want to put your patient on a BVM ventilator. You know, give them any kind of oxygen because something is wrong. So yeah, that was an inside look at my personal aid bag and kind of more or less what you guys are going to see when you guys get to AIT at Fort Sam Houston. I'm going to leave a description down below of some supplies you guys could get ahead of time if you just want to practice or get a feel for the stuff that you're going to get at AIT. Now, when I don't say practice, I don't mean start sticking. No, you can get in big trouble for that. So please don't do that. I actually mean just that so you guys can get an understanding of what the gear is. That way when you get to AIT, you're not as nervous. But please, no sticking. So I hope you enjoyed this content. See you guys next video. No